Welcome to the Los Angeles Harbor College Nursing Simulation Lab. In this lab, you will interact with your peers and a high-tech mannequin in a realistic environment in order to experience scenarios that you might encounter during your nursing career. First room you will enter is the simulation control room. From this room, we operate the high-tech mannequin, as well as the audio-video equipment that is used in debriefing. Cameras in the room are located in the ceilings. The first camera is above the patient. The second is above the nursing station. Lastly, a microphone above the patient records all the sound from the room. Let's get acquainted with the simulation lab. As you enter the room, you will notice a hand sanitizer, which acts as your sink. Immediately to your right is the nursing station. You can use the phone to call the doctor's office, the pharmacy, or anyone else. Look into reference books and manuals. Do calculations. There's also a small box of supplies with patient labels and other miscellaneous office supplies. Most important at the nursing station is your patient chart. Inside you will find patient labels, doctor's orders, labs, vital charts, and any other documents important for your patient. Above the nursing station is your S-bar and patient handoff sheets, as well as a clock. And lastly, at the nursing station, you will find a trash can. When the facilitator calls time, don't worry about cleaning up or throwing away excess trash. The sim technician will take care of that for you. Immediately to your left is your medical supply area. In the left cabinet, you will find Foley catheter trays, briefs, and irrigation trays. In the right cabinet, you will find respiratory care equipment, including spirometers, nebulizers, and BVMs. Below the cabinets, you will find an assortment of equipment necessary for your scenario. This includes items such as gloves, saline bottles, various bags and labels, various gauze, bandages, an assortment of tubing, culture swabs, breathing masks, and specimen cups. Below you will find an assortment of towels, blankets, pillows, sheets, chucks, and gowns. To the left of the room is your med cart. Here you will find your MAR, as well as your narcotics sign-out sheet. You will also find an electronic thermometer and blood glucose monitor. The results of these devices will be told to you by the facilitator. Remember, don't actually stick the patient. In the bin, you will also find various shapes and sizes of tape, labels, gauze and alcohol pads, a pill crusher, med cups, band-aids, and most importantly, the med card key. While holding the key, make sure that the straight edge is up like this. Remember, there are two locks on the med card, one for the blue drawers and one for the med drawers. Find your patient drawer, and you will find all the medication supplied for the beginning of this scenario. The top blue drawer contains all of your narcotics. Narcotics are available in both PO and IV-IM forms. The med cart also contains an insulin drawer and an emergency drawer. The second blue drawer is equipped with various types of syringes and needles. And the bottom blue drawer contains IV start kits and IV bags of various types and sizes. The med cart also includes a sharps container. To the left of the med cart is your balance, and to the right, a container for dirty linen. Further along, you will find Braslow bags and an overbed table. Beyond this is the emergency crash cart, which is fully stocked and should not be operated unless specifically told. To the right of the mannequin is the bedside table. top shelf contains personal items for the patient, such as toothbrushes, gum, and denture cups. The bottom cabinet contains all of your urinals, bedpans, and fracture pans. On the wall, you will find the patient board, and below, seats for patient confederates, such as friends and family. At the head of the patient bed, you will find a patient monitor, mannequin lubricant, used for Foley's, an SpO2 monitor, and, if necessary, heart monitor leads. You may also find an IV pole with various IV bags already started. You may or may not have a pump going. Directly above the patient is a suction device, various types of air and oxygen. As well, you will find the blood pressure cuff. Now let's take a look at the mannequin itself. Remember, this mannequin responds to your actions and attitude, so remember to listen to the mannequin carefully. The head of the mannequin contains a speaker which the facilitator will use to communicate with you as the patient. While the patient can accept NG tubes, it is unable to take actual liquid. Feel free to move the patient in any way you see appropriate. However, please note that while using the arms, you can move them vertically, but must remain very limited in horizontal motion. There are many things you can do to assess the patient. You can track the carotid pulse and respiration rate. You can auscultate chest and heart sounds, as well as sounds from the abdomen. On the patient's left arm, you can check for brachial and radial pulse. You can also use the cuff to check for blood pressure here. Remember to place the stethoscope here in this circle in order to auscultate the blood pressure sound. The patient's right arm is for IV and injection. Injection sites are located here in the deltoid, here in the ventral gluteal, and finally in either vastus lateralis. While continuing your assessment, you may notice yellow stickies, which provide important information about the patient. Remember to ignore the cables leading from the patient's back and the various blood IV bags located underneath the mattress and underneath the bed. To maneuver the bed, simply use the controls located on either handrail. The foot brake is on either side, and the handrails are operated with the push of this black button. Remember, in simulation, receive, assess, chart, and act. Relax and remain focused. And don't forget about the patient call button.